Good afternoon, everyone. My name is Tom Ward Davis, and I'd like to welcome you to the Activ Doctors Online July webinar. Today's webinar is entitled Cord Blood Awareness Month. And on the theme of cord blood, we will be taking a look at what cord blood is, as well as stem cells and their many uses, before we move on to blood banking. And I'd like to introduce our guest speaker, Dr. Howard Zahalsky. Dr. Zahalsky has been ADO's medical director since 2010. And as you can see on the slide, he has a very impressive medical background. Dr. Zahalsky, welcome, and thank you for joining us today.
Thank you very much, Tom. Thanks for having me. So, July is Cord Blood Awareness Month. We're going to talk a lot about cord blood today, and in particularly how it can help you, your children, your entire family. But the first question that's going to come up is, what is cord blood? So let's go on to the next slide. So the first thing we have to discuss when we're discussing cord blood is when you have to start planning to collect cord blood. And the answer is you can't wait until the baby's born, or even a couple of days before the baby's born, before you can start thinking about cord blood. Cord blood collection needs to be planned weeks or months in advance. There is a lot of equipment that is usually sent to you in a little box from the cord bank company that needs to be gathered up, and you need to read the instructions because it is by no means idiot-proof. You have to coordinate it with you, if you are the pregnant person, your spouse, if you are the spouse of the pregnant person, your wife, and your doctor needs to be carefully involved. So this takes a bit of planning and needs to be started in the early to mid-pregnancy if you think that you're going to want to collect cord blood. There's a lot of decisions to be made, including what kind of cord bank to use. There are public banks and private banks, and we're going to go into the difference going forward. And when it comes to the private banks, there are over 20 private cord banks to use, each with different rules, regulations, and prices. So there's a lot of decisions to be made, and the earlier in the pregnancy that you start to think about cord blood and cord blood banking, the better. Now, on to the next slide. So, what is cord blood? Cord blood refers to the umbilical cord. Here you can see a newborn baby with an umbilical cord coming out of the baby's belly. The umbilical cord is what feeds the baby while you are pregnant. All of the food, oxygen, nutrients all come through that umbilical cord that in this picture has been clamped with a little plastic clamp. It's also known as the thing that the dad cuts when the baby is born. It's also euphemistically known as when you cut the cord when a child wants to separate from their parents, because this is a direct connection between the blood supply of the baby in the uterus and after birth, and the mother. But now let's take a closer look at what that umbilical cord actually is, and we'll go on to the next slide. Here is a cartoon, so as not to gross anybody out, picture of what the umbilical cord is in a normal umbilical cord. As you can see, it's kind of twisted up, kind of like a rope or a cord. And there is this big blue tube that's winding around. That's actually a vein. And then there are two red hollow tubes, and those are the arteries. Arteries pump the blood, including the nutrients and the food, to the baby, and the vein, which is larger, takes all of that back away from the newborn baby. The good cord blood, so to speak, is found in the vein because the developing baby has all of those important tissues and cells in it. So the food and nutrients come to the baby, and then the baby releases a little bit of its special cells into the blood heading back to the mother, and that's where you collect the cord blood from. Now, when we're talking about how do we get that blood, that gets a little trickier, and we'll see a picture of that on our next slide. So this is a more medical picture, sorry if it makes anyone squeamish, of actually harvesting the blood. After the baby is born, the cord is clamped and cut so that the baby can be given to the nurses and they can check out to make sure the baby's okay. And then usually before even the placenta is delivered, while the placenta, which is the bundle of tissues that is still attached inside the mother's uterus, is coming out of the mother with the cord now dangling in free air, a needle is stuck into that vein, and you can see that blackish stuff in the tube there. That's blood being drained out of that vein. You have to go fast, and the reason is that after a baby is born, there are literally only seconds to minutes until that blood starts to clot. And once the blood is clotted, it's useless. So you need to get the blood as quickly as you can. Sometimes, if there's not enough blood, the OBGYN will actually deliver the placenta and then squeeze the placenta, trying to squeeze some extra blood out of the placenta into the tube here. The test tubes are then sent to the lab, and they look through the blood for the valuable stem cells. This is what we're after. We are after stem cells. Stem cells are the cells in a baby or even in a fetus that have the ability to turn into other cells. They are kind of the building blocks of the human body. And we're going to talk a little bit more about stem cells on the next slide. So here are some big medical words: hematopoietic and pluripotent. What does that mean? Well, there are different types of stem cells in the human body. The ones that you've heard about that get a lot of press are the pluripotent stem cells. These are cells that can turn into literally everything. They can turn into brain tissue. They can turn into heart tissue. They can turn into blood. They can turn into bones. They can turn into skin. They can do anything. The stem cells that are harvested with cord blood are not those cells. They are called hematopoietic stem cells. They are stem cells that can only turn into different types of blood or blood-based cells. And I want to use an analogy for you. Imagine you have a newborn baby. A newborn baby can become anything. They can become a doctor. They can become a lawyer. They can become a car salesman. They can become a janitor. They can become president of the United States. But at some point, that baby, if the parents are lucky, goes to school, gets good grades, goes to college, gets good grades, maybe goes to medical school. When that child is done with medical school, they still have a lot of potential. They can be a surgeon. They can be an eye doctor. They can be a dermatologist. But they probably aren't going to be a lawyer anymore. Why? Because to start all over again and go back to law school, at that point, once you've spent hundreds of thousands of dollars on medical school, is probably unrealistic at this point. So you still have a lot of potential, but you don't have all the potential that you did back when you were a newborn baby. That's the difference between the different stem cells. A hematopoietic stem cell can become just about any type of blood product. A white blood cell that fights infection, a red blood cell that carries oxygen, even platelets which help the blood to clot. But it can't become heart anymore. It can't become bones anymore. Because of that, these stem cells that you get from cord blood generally help to treat blood diseases. In order to get these pluripotent stem cells, the ones that can turn into anything, you can't wait until you're collecting the hematopoietic stem cells from cord blood. The only way to get those pluripotent stem cells are from a much earlier stage in development. And although it is certainly politically debatable and there's a lot of arguments on it, the only way we get quote-unquote fresh new pluripotent stem cells are from pregnancy terminations early in this pregnancy, before the baby is even formed into what many would consider to be a baby, when it is still more of an unformed mass of cells. All right, let's go on to the next slide. So this is a picture of what we call the hematopoietic stem cell hierarchy. What happens to these hematopoietic stem cells? And I already talked a little bit about all of the different things that one of these hematopoietic stem cells can be. And you can see the list on the bottom: erythrocytes, which are red blood cells; platelets, which help clot; and then 6 different types of white blood cells, which fight infections. On the right side, you see what are called T lymphocytes and B lymphocytes. Those stem cells tend to fight viral infections. The ones towards the middle that are pink with multiple parts, multiple bright purple parts, those are neutrophils and eosinophils. Those tend to fight allergies or bacterial infections. So there are a lot of different problems with a lot of different types of cells that can be fought with hematopoietic stem cell transplant. Let's go on to the next slide, and we can see some of the diseases that can be treated with hematopoietic stem cells, such as those that you get from cord blood. On the left side, you see the ones that we already know can be treated with stem cell transplants of hematopoietic stem cells: leukemia, certain immune deficiency diseases, myelomas, which is a type of white blood cell cancer that people tend to get in their 50s and 60s. Sickle cell anemia, which is more common among African Americans when your body tends to destroy its own blood cells. Lymphoma, which is a tumor of your infection-fighting lymph nodes. And thalassemia, which is a condition more common in Mediterranean patients, again, where your body tends to destroy its own blood cells. Now, they've been doing more and more research, particularly in other countries, and they found that even though hematopoietic stem cells pretty much only turn into blood-related cells, that there may be some benefit of hematopoietic stem cells being used for neurological diseases, that with a little bit of tweaking, these cells might be able to form into nerve cells as well. As a result, there is a lot of data and studies being done to see if they might be able to help with Alzheimer's disease, Parkinson's disease, spinal cord injuries, strokes, and cerebral palsy and muscular dystrophy. And at the top of the list, you can see there's even a little research suggesting that they might be able to help with diabetes as well. They're doing the diabetic research in China. The cerebral palsy research is being done in North Korea. And we're even looking now to see if these hematopoietic stem cells might be able to be used to rebuild cartilage in people with injured knees in South Korea and the United States. A final thing that we're looking at for hematopoietic stem cells is that they might actually be able to help in some cases with autism, but this is still very early in the research. But all of these are real diseases that people really get, that through hematopoietic stem cells, we might be able to treat these conditions. So, how do we go about saving the stem cells? And we'll go on to that on the next slide. So the answer is cord blood banking. As I said, when a person gives birth, you try and collect the cord blood with all of those hematopoietic stem cells. And then you have this choice. Do I put them in a public bank or a private bank? Now, a public bank is considered kind of the more ethical way to approach things these days. Unfortunately, there are only about 5 public banks out there, and they tend to be located in the major cities of the United States. Los Angeles has one. New York has the oldest and most famous one. And what they do here, you call them up or email them early in the pregnancy, and they will send you all of the equipment that you need, including the needles, the test tubes, the boxes that you need to collect the stem cells. They then take your cord blood, and it is no longer yours. It is now for public use. So if somebody else on the other side of the country needs a stem cell transplant for leukemia, they might use your stem cells. Obviously, this can be very helpful, much like giving blood at the Red Cross, to help people who really, really need help, but you lose the ability to use the stem cells yourself. Why might you need your own stem cells? Well, maybe the child in question who was just born might need their own stem cell transplant, and we're going to talk more about that in a second. Or the sibling of that child. Matching stem cells to a person can be very, very difficult. And if one of your children has given stem cells, you've saved the stem cells for one of your children, the chance that a sibling child would be a perfect match is 25%. Your chance of finding a match through a random donor through one of these public banks is much, much lower than 25%. So your chances of maintaining a match should one of your children need stem cells is much higher if you bank privately than if you depend on public banking. So that's a good reason to keep it yourself. On the other hand, there are so many people out there who need stem cell transplants for leukemia, for lymphoma, that given that the odds of you ever using your own stem cells are low, there is a tremendous argument to be made for public banking. On the other hand, other people want to treat their hematopoietic stem cells as an insurance policy and keep them for themselves, much like you would keep your own money for yourself and not just give it all to the government or to charities. Some of it you want to keep for yourself, so you might be able to go on vacation or use it to buy homeowners insurance or car insurance. And this is a different type. This is health insurance, that you will stay healthy. The cost of this insurance is a little bit pricey. As you can see, the cost of private banking, the initial cost for them to send you their kit and for them to store your own stem cells yourself, it says here $1,000 to $2,000 initially. I saw some places that charge up to $3,800 initially. And then there's a yearly fee for the storage, which can be over $100 a year. Now again, you hold on to the ownership of these stem cells. If this child needs a stem cell transplant, you have the stem cells available. If one of their siblings needs a transplant, you have a 25% chance that any saved cord blood that you have will be a perfect match for a sibling of the child whose stem cells that you changed. Now, what are the odds that you will need your own stem cells or that a family member will need your stem cells? Well, to hear the companies talk about it, they say that based on the diseases that can be possibly treated by stem cells, there may be up to a 1 in 27 chance that you will need all of your stem cells. Now, that's an overreach. They're counting diseases that are still investigational in terms of using stem cells. They are counting diseases that stem cells have never been successfully used to treat the disease. The journal Obstetrics and Gynecology actually did a study of the issue, and their number came out to be about 1 in 2,700 chance that you or a immediate family member, a sibling, would actually need those stem cells. The American Academy of Pediatrics even said that 1 in 2,700 was an overreach. They said that the chance of actually the child in question needing their own stem cells is closer to 1 in 200,000. And an Institute of Medicine study said that there have only been 14 ever cases of children using their own stem cells for a stem cell transplant after privately storing their stem cells. So the chance of you actually using those stem cells yourself after spending all of that money is at best very, very low. So I'm going to say this might be a good reason to consider public donation of the stem cells of your baby if you are having a baby. The other issue is, do you want to use your own stem cells? And I want you to follow my logic here for a minute. Usually you're going to use stem cells if you have one of these horrible diseases that we were just talking about: leukemia, lymphoma, myeloma. A lot of those diseases have at least a certain genetic basis. And it may be that if you develop leukemia, You don't want to use your own stem cells, which still may already carry the genetic basis for the leukemia. It might be better to use the stem cells of somebody else, if they're available, who did not have leukemia, who just donated randomly, who hopefully lived a long and healthy life, rather than using your own potentially damaged stem cells that led to a person who developed leukemia. So there is certainly an argument to be made that autologous, or using your own stem cells to treat one of these dangerous diseases, may not always be the best idea. That said, if you have leukemia or lymphoma and you are looking at the potential of dying, trying your own stem cells, which you will not have any transfusion reactions to, which is one of the problems of stem cell transplants, may be at least worth a try when faced with the alternative of death. In any event, these are all very difficult questions. Do we do it privately and take the cost, even though there's low chance of using it? Do we do public donation? Do we collect the stem cells at all? Because at the time of birth, you've got a lot of other things on your mind than worrying about if your OBGYN is properly collecting the blood from the umbilical cord. So these are all complicated questions that you should discuss with your significant other and with your OBGYN before making a final decision. All right, let's go on to the next slide. So how can Activ Doctors help you with these and other health decisions? Well, number one, keeping your personal health records online, secure, and available can be very valuable, especially when dealing with some of these issues. We will keep track of your family history. We can keep track of blood type. We can keep track of any diseases, other diseases you or your family members may have. And should the need arise for stem cells or other treatments, you will have all of your records available. With our online second medical opinion, should you develop one of the serious diseases that we've talked about, you can get a second opinion from our network of over 2,000 specialists in as fast as 48 hours to help you make some of the decisions we're talking about. And finally, if your doctor is participating in Activ Doctors, you can use our e-consultation feature so that maybe you can have one of these discussions with your doctors online and not actually need to go into their office for an appointment. With that, I'm going to turn it back over to Tom, who can tell us a little bit more about Activ Doctors Online and how to get started with Activ Doctors Online.
Well, thank you very much, Dr. Zahalsky, for that excellent presentation. Our ADO vision is to educate, engage, and empower members to take control of their health destiny to save time, money, and even lives. We hope you've enjoyed today's presentation, and we invite you to start a 30-day free trial over at activdoctorsonline.com and by clicking Get Started. For more information or to schedule a demo, you are invited to contact either Dr. Zahalsky or myself using the contact information on screen now. And before we leave, I'd like to extend an invitation to our next webinar. August is Immunization Awareness Month. So we'll be taking an in-depth look at immunization, which is just in time for all you parents with kids going back to school in the next month or so. To find out how to register and for more information about Activ Doctors Online, you can follow us on all the major social media channels. We've been live tweeting some of the quotes from today's discussion, so you are welcome to join the conversation. And with that, I'd like to thank you for joining us today, and we look forward to seeing you next time.